Good morning and afternoon for some of you, and welcome to our Alaska Collaborative on Health and the Environment teleconference titled, Will the New Federal Chemicals Policy Adequately Protect Public Health? Understanding the Strengths, Limitations, and Implications of the Lautenberg Act. My name is Diana DeFazio, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. CHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. CHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. You can find more information at akaction.org and at healthandenvironment.org. I sent a link to a PDF of the PowerPoint presentation yesterday to everyone who'd registered. All three of our speakers will be using the same presentation, so you only need to download one document for today's call. They've made it really easy for you. If you don't have that document in front of you now, you can download it at akaction.org. Just scroll down to the post about today's call and you will see the link. Now it is my pleasure to welcome and introduce all three of our speakers. First we have Eve Gartner. Eve Gartner is a senior attorney in the Healthy Communities program at Earthjustice, where she heads the organization's legal efforts to protect human health from toxic chemicals. Prior to joining Earthjustice, Ms. Gartner spent more than 15 years as an attorney working on issues involving reproductive justice, including serving as the Deputy Director for Litigation at Planned Parenthood Federation of America. She is a graduate of Columbia University School of Law. Next, we'll have Mark Mitchell, and Mark Mitchell chairs the National Medical Association's Council on Medical Legislation and co-chairs the NMA's Commission on Environmental Health, where he provides environmental health education and advocates on behalf of NMA. A preventive medicine physician trained in environmental health and health policy, Dr. Mitchell has spent over 20 years working in the public health sector, including as director of the Hartford, Connecticut Health Department. He spent 15 years working with environmental justice communities to prevent and reduce environmentally related disease, as well as to change policies that are detrimental to environmental health. Dr. Mitchell was a principal investigator on the first ever physician survey on climate and health, and he has served on several US EPA and FDA advisory committees, and has received a number of awards for his community and environmental health leadership. And finally, we're going to be hearing from Ansje Miller. Ansje Miller is the Eastern States Director for the Center for Environmental Health. In that role, she represents CEH with elected officials and others in New York and Washington, D.C., as well as directs the activities in the Eastern States Office. For over 20 years, Ms. Miller has led both state and national advocacy coalitions and has led successful legislation and regulatory campaigns to promote environmental health, leading to the reduction of exposures from toxic chemicals and efforts to mitigate climate change and promote renewable energy. Her organizing efforts, research reports, and popular articles have also led to the creation of numerous policies on global warming, including California's AB 32. Ansje currently serves on the board of the Reproductive Health Technologies Project and on the steering committees of Safer Chemicals, Healthy Families, and the Just Green Partnership. Prior to her work at CEH, Ansje founded and directed the Environmental Justice and Climate Change Initiative, a coalition that brought together the nation's leading environmental justice, faith-based, and policy organizations to advocate socially just policies on climate change. And again, I'd like to welcome all three of you to today's call. We're so happy to have you with us this morning. And Eve, you may go ahead and begin.
Great. Thank you so much, Diana. And thank you to CHE for convening this really important conversation. I think that the question that you've outlined in the title, will the new TSCA law adequately protect public health, is obviously a critical question. It's one that I am not going to answer in my presentation. What I'm going to do is just try to briefly set out why we needed TSCA reform and what the new law does without commentary on it, and then turn it over to the others, and hopefully we can have a robust discussion after the presentations. So if you want to go to slide 2, why did we need TSCA reform? And we can, many of you already know this, but just quickly, the old TSCA, the 1976 TSCA, grandfathered in over 60,000 chemicals without testing and critically, without a process for ensuring that they ever get reviewed for safety. The old TSCA allowed new chemicals to enter the market without EPA having to make a safety finding. When EPA did attempt to evaluate the safety of a chemical and determine if it presented an unreasonable risk, the unreasonable risk determination was not exclusively a health-based finding, but it had to include considerations of cost. And if EPA got to the point where it concluded that there was an unreasonable risk and a chemical should be regulated in some way, it was limited to the least burdensome regulatory option. And finally, on my list, and I'm sure others have their own list of major flaws with the old TSCA, the law imposed major hurdles to EPA even asking for safety testing of chemicals. So it was clearly a flawed law and needed reform. Go to slide 3. So I think it's important before we get into the details of the TSCA reform law, what is TSCA and how is it different from other environmental statutes? So the core mandate of TSCA is to look at chemicals as really from cradle to grave. Under TSCA, EPA has to ensure that the manufacture, processing, distribution, and commerce, use, and disposal of a chemical substance, so the whole life cycle of the chemical, or any combination of such activities, and that's obviously key language, does not present an unreasonable risk of injury, and then under the new law, without consideration of costs, and again, under the new law, specifically requiring that EPA look at unreasonable risks to potentially exposed or susceptible subpopulations, all of that under the reasonably foreseeable conditions of use, which I understand to mean it doesn't take into account catastrophic exposures to a chemical. If there's a massive chemical spill, that's not a reasonably conditions of use, and TSCA doesn't, most likely doesn't take that into account, and there may be some exceptions to that. Slide 4. So also as background, what are the substances covered by TSCA? Just quickly, TSCA basically covers all chemical substances and under many of its provisions, articles or products containing those substances. It doesn't cover pesticides, it doesn't cover food, drug, or cosmetics or things regulated by the FDA, and it doesn't cover ammunition. Slide 5. So now getting into the meat of what the new law does. So I think one of the major innovations and improvements in this new law is it sets up a system under which EPA is going to be required to actually review all now 80,000, it was 60,000 in 1976, now 80,000 plus chemicals that are approved for sale in this country, to decide first whether those chemicals are high or low priority, and second, to conduct a risk evaluation of all the high priority chemicals. And then for any high priority chemical for which EPA concludes there's an unreasonable risk, it must order risk management. So that's the process for existing chemicals, and that's what I'm going to be focusing on in the next few minutes. Slide 6. So first, with respect to prioritization, EPA, once a chemical is chosen, goes into the hopper to be prioritized, EPA has a year to decide whether it's high priority or low priority. And high priority means that it may present an unreasonable risk to health or the environment, including to the vulnerable subpopulations who are affected. In order to make that determination, EPA can order chemical testing. It cannot decide that a chemical is low priority because of lack of data. So it has to, low priority means that it affirmatively has data indicating that it does not or may not present an unreasonable risk. If there's lack of data, even after testing, then that's warrants high prioritization. Once the prioritization process has started, once a chemical has goes into the hopper for prioritization, EPA is supposed to seek information about the chemical from the public. So that's an opportunity for us to weigh in about that. And then once it has decided whether a chemical should go into the high priority or low priority bucket, it's supposed to publish proposed designations, proposed prioritizations, and get public comment on that. So there's a couple opportunities in the prioritization process for the public to weigh in. Slide 7. I don't know if the only key thing on this slide is that if EPA makes a decision to designate a chemical as low priority, that decision can be challenged in court. In addition, a decision that a chemical is low priority is subject to reconsideration. So if new evidence comes out later on that somebody thinks warrants reconsideration and suggests that EPA should consider that chemical high priority, they can submit that new evidence to EPA and ask for reconsideration of the prioritization decision. Slide 8. So the heart of how new TSCA is designed to protect health and the environment is through this risk evaluation process and going through the chemicals that are currently in use and deciding which ones present unreasonable risks, and then hopefully managing those risks. So which chemicals are now teed up to go through this risk evaluation process? So this is very complicated. So there are 4 buckets of chemicals that must go through the new risk evaluation and then risk management process. First, and I'm sure most of you are familiar with some of this, EPA is required to select 10 chemicals from the TSCA work plan, which must go through risk evaluation, and it must do that by December 19th, so just a little more than 3 months from now. So that's the first bucket. The second bucket, which is going to be the ongoing bucket, those first 10 chemicals is just like a kind of getting an initial infusion of chemicals into the process. But on an ongoing basis, most of the chemicals that will be evaluated will come through the prioritization process. And by December of 2019, there needs to be 20 additional chemicals undergoing risk evaluation that have come through the prioritization process. So then the third bucket is chemicals that are nominated by their manufacturer for risk evaluation, and we'll talk about that a little bit more later. And the final bucket is a pretty limited set of persistent bioaccumulative and toxic chemicals, PBTs, that are listed on the TSCA work plan and that are not metals. And we believe that there are approximately 9 of those chemicals. And I'll discuss those a bit more later as well. Slide 9. So I want to just outline what this risk evaluation process will look like. So as soon as a chemical is selected for risk evaluation under any of those 4 processes that I just laid out, EPA must immediately start looking at what should the scope of the risk evaluation be. And it must publish the scope of the risk evaluation within 6 months of the initiation. And one of the key things about the scope is that that's the time when EPA will identify which potentially exposed or susceptible subpopulation it will include in the risk evaluation. So one of the major flaws from a process standpoint in the new law is that there's no explicit procedure in the statute for the public to weigh in to EPA on the proper scope of the evaluation. So that's something that we can try. We've asked EPA to write that in to its regulations, but we don't know if that will happen. So it's something to be aware of, that if that doesn't get officially written into EPA's rules will have to find unofficial ways to make sure that EPA is aware of our views on the proper scope of a risk evaluation. Once EPA has drafted a risk evaluation, it has to publish that in draft form and accept comments on the draft risk evaluation. And then the entire process from scoping to final publication of the final risk evaluation has to be concluded within 3 years with the opportunity for one 6-month extension, so 3.5 years for the risk evaluation process. Slide 10. So I mentioned this earlier that one of the buckets of chemicals that EPA will conduct risk evaluations for are chemicals that the manufacturer asks EPA to conduct the evaluation for. So there's a couple of limitations on this. First, if a manufacturer asks EPA to do the evaluation, it has to pay for it, pay for the evaluation. And I think it still remains to be seen exactly what that, how much money that is and how that will work and how it will be calculated. In addition, the number of manufacturer requests that EPA will accept is limited. It has to be a minimum of 25% of ongoing reviews if there are enough requests to get it that high, but it can be no more than 50% of the ongoing risk evaluations. So how that all gets calculated, again, remains to be seen. Slide 11. As I mentioned earlier, under the new law, there's a special provision that fast tracks certain persistent bioaccumulative and toxic chemicals. There are nine of these chemicals that are on the work plan that are not metals. And for those chemicals, there's essentially a presumption that they pose an unreasonable risk. So EPA doesn't have to do a risk evaluation to determine if they present an unreasonable risk. It can go directly to the risk management phase. But in order to do the risk management, it has to do an assessment of how the chemical is used and where the exposures are, so it knows how, what sort of measures to put in place to reduce or eliminate those risks. So it has to do that kind of exposure assessment. And the other key thing about these PBT assessments is that whereas for most chemicals that will be regulated under TSCA, EPA has to regulate them to such that the chemical no longer presents an unreasonable risk. That's the standard for most chemicals. But for the PBT chemicals, EPA has to regulate them to the extent practicable. So it's a stronger standard for regulation for these PBT chemicals that are on the work plan. And it has to come out with final risk management rules, again, just for those 9 PBTs within 3 years, so faster than other chemicals, which just have to, the risk evaluation has to be within 3 years, but then there's another year for the risk management. So in terms of, so slide 12. So risk evaluation volume, as I said earlier, they have to be doing at least 20 high priority chemicals within 3 years. They have to do the first 10 chemicals on the work plan and then the 9 PBT. So that's what we envision in the short term, the number of chemicals that EPA will be evaluating. Once an evaluation is complete, EPA has to immediately start another one. So it's an ongoing process that, as many of us have calculated, will probably take thousands of years to complete for the 80,000 chemicals. But it is a process that has to keep going. Slide 13. One thing that I think people are not entirely focused on is that before this new TSCA rule went into effect, EPA had already started a risk evaluation process for several chemicals that are on the work plan, which it established in 2012. It has already completed risk assessments for 3 chemicals: TCE, methylene chloride, and NMP. In addition to completing risk assessments, it has developed proposed risk management rules, which it has sent to the Office of Management and Budget already. So the great likelihood is that the proposed risk management rules for those 3 chemicals will be published for public comment by the end of 2016. And while a lot of us have been very focused on the first 10 chemicals that EPA picks, for good reason, it's very likely that one of these chemicals, TCE, methylene chloride, and NMP, will be the ones that will, to the extent there is litigation about the meaning of some of the terms of the new TSCA, like what is unreasonable risk, it's very likely that that litigation would arise in the context of one of these chemicals that EPA has already assessed under the old TSCA. Slide 14, the new TSCA gives EPA much broader authority to test chemicals, and it can order testing without having to go through a rulemaking process, which is one of the major hurdles in the old TSCA. So we expect to see a much more robust testing program at EPA, with EPA directing the manufacturers to do specific tests on their chemicals to determine both safety and potential exposure. Slide 15, citizens can bring legal challenges to EPA decisions on low priority chemicals, and after a final risk management rule is issued, citizens, and that includes chemical manufacturers, can challenge both the unreasonable risk finding as well as any risk management measures. So it can challenge them from either end, whether the challenge can be that they're not protective enough or that they're too stringent. Slide 16. One other thing to remember about TSCA, and this was true of the old statute as well, is that citizens have the ability to petition EPA to adopt rules and orders, including to asking for a safety testing, including to ask for a Section 6 rule to regulate a chemical. And EPA has to grant or deny a citizen petition within 90 days. If it denies the petition, it has to explain why, and a denial of a citizen petition can be challenged in court. So those are important mechanisms that citizens can utilize to make TSCA, in theory, more responsive to the needs of the public. So that is it for me. Thank you very much.
So hello, this is Mark Mitchell, and so I certainly appreciate the opportunity to speak to all of you today. I appreciate Eve going over a lot of very dense, very complex requirements of the new update to TSCA. I will talk a little bit more about what vulnerable populations are. We'll talk about the health and safety standard, the prioritization, and then what happens to legacy exposures. So let's go to the next slide on vulnerable populations. When I say vulnerable populations, it's defined specifically as potentially exposed or susceptible populations. And it's defined as by the administrator, and these are populations that are differently exposed to chemicals under reasonable foreseeable circumstances during the manufacture, processing, distribution, and commerce, use, or disposal of a chemical. And the susceptible populations are can be susceptible to greater adverse health consequences from chemical exposures than the general populations. And the law says that this may include infants, children, pregnant women, workers, and the elderly. So next slide. So under the health and safety standard is a big win. So what it says is that new and existing chemicals must be safe for these vulnerable populations. However, the EPA administrator will decide which vulnerable populations will be considered for each chemical that is reviewed. And there's no explicit mention of vulnerable communities, although many people think that fence line communities and other vulnerable communities do need to be protected under the law. And the details of how quickly and which chemicals are evaluated first in the updated TSCA will be very important to the health considerations. Next slide. So within the first year, EPA must establish a process and criteria for identifying high priority and low priority chemicals for evaluating and determining their safety, as Eve has said. And EPA will publish a list of chemicals that are being considered for prioritization. And so once this is published, then that's the opportunity for us, for the community to weigh in. Obviously, industry also has the opportunity to weigh in. And the priority chemicals, the first priority chemicals, will be considered based on recommendations of governors or state agencies. And so again, maybe we can influence our governors or state agencies to suggest certain chemicals that we believe should be included. They will also look at hazard and exposure data, whether they're persistent, bioaccumulative, and toxic chemicals. And they also can consider the exposure to vulnerable populations. There's a provision to say that chemicals that are stored near drinking water should have a priority, and if they're high volume production of chemicals, then they can also be high priority. So once it's published about which chemicals are being considered, then EPA will request information on these chemicals from interested parties. EPA will use this information to determine whether the chemicals are classified as high or low priority. And then this priority is only the priority for review and regulation. So if they're high priority, then they will go forward to be regulated and reviewed. If they're low priority, they will not need to be need to be any further review and or regulation of those chemicals. So next slide, high priority chemicals. For high priority chemicals, EPA conducts a safety assessment, which is really a risk assessment, which integrates toxicity, use, and exposure information. Then they will scope out the uses. They'll figure out what they're going to regulate, which specific uses they're going to regulate, which toxicities they're going to regulate, and which vulnerable populations they want to protect. Then they will make a safety determination about what kind of restrictions are needed for the chemical to meet the safety standard. So that's what happens for high priority chemicals. But the risk assessment or safety assessment, as you know, has often been used against environmental justice in tribal communities. And so we have a lot of concerns about how they're going to do these safety assessments. An example is that, if you have anecdotal evidence about a chemical, about that certain people are exposed in certain ways that results in disease, oftentimes the evidence has been declared insufficient and assumed to be false. And so instead of accepting actual data, they will use theoretical assumptions that are assessed as true. So this is a real problem in the way that risk assessments and safety assessments have been done previously. I think that it's important for us as a community to weigh in to make sure that it's done, that they do a better risk assessments than they've done in the past. On the next slide, I'd like to talk a little bit about legacy exposures. Environmental justice and indigenous communities are often exposed to toxics from legacy chemicals. And we're often exposed in ways that are unpredicted. If you're by the manufacturers, unpredicted by government. Oftentimes there are cultural practices that that will lead to exposure of chemicals at higher levels than would be predicted in other populations. So legacy chemicals are the definition that I use for legacy chemicals are chemicals that are no longer in use but have not been disposed of properly. And so legacy chemicals can be contaminated soil in brownfields. They can be underground storage tanks at abandoned industrial sites. They can be lead in paint or lead in pipes that are no longer allowed. So Reform TSCA doesn't really address these kinds of exposures. So this is another problem with this TSCA. There may be a way of forcing that, but it's not specifically mentioned in this. So those are some of the issues that we have, I think, as environmental justice communities and as tribal communities with the exposures and high priority chemicals and prioritization. So next I'll turn it over to Ansje to talk about state actions and priorities.
Thanks, Mark. Great presentation. The vulnerable populations piece in particular is really critical, and so I'm glad that there's a focus on that in this call. And thank you, Steve, for laying all of that out. And I wanted to thank Shay Alaska for having this call because I think it's really important when we think about answering the question, will the new federal chemicals policy adequately protect public health? The answer really is, it depends. And calls like this, getting the information about what's in and what's out, really are variables in that answer. So I'm going to focus in my talk on what state actions can still happen, what we can do at the state level, and the thinking about what are the first 10 chemicals, priority chemicals that EPA could be taking on. As both Steve and Mark talked about, within the first, through December, EPA has to identify the first 10 chemicals that it's going to take on. So we'll talk about that. So I'm Ansje Miller, and I'm with the Center for Environmental Health. In terms of the state actions that are protected, when EPA takes steps to regulate a chemical, that's the point at which states are often prohibited. But there are some exceptions, recognizing that in the decades that we've had a failed federal regulatory system, states have really taken the lead to protect people from toxic chemicals and filled that void. And recognizing that important role that the states have played, and the fact that businesses want certainty in understanding what is okay in their products and what's not, there are a number of state laws that were preserved so that they can continue to be enforced. That starts with actions that were taken under state laws before April 22nd of this year. And I've highlighted actions on the screen because the law differentiates between an actual, a whole law and actions taken under those laws. So an example, I'm going to reference an Alaska law since we're on a call hosted by Alaska. There's a ban in flame retardants in kids' furniture that was passed in 2015. So that's an interesting case because the entire law contains the actions. So it bans a certain number of flame retardants in children's furniture. Because that was passed before the April 22nd, 2016 timeframe, any actions taken under that law can continue to be enforced. So those bans will remain in place. Now, the second piece is that the whole law. So any actions taken at any time pursuant to a state law that was in effect on August 31st, 2003. So a law that was in place in 2003, the entire law is protected. So going back to the case of the ban on flame retardant, if, for example, the law had said, here's the number of flame retardants that is banned in children's furniture, and then also the state agency can regularly review as new flame retardants come on the market, and those that are deemed to be harmful will go into the ban and will be banned in children's products. Now, because those actions will have taken place after April 22nd, 2016, those new actions will not be able to be enforced. They would be preempted. So there are some state laws that have that kind of situation. So one of the most complicated laws I saw on the books in the states is California's Safer Consumer Product Law, which sets up a complicated process. And so they're able to list chemicals, they're able to have an alternatives assessment, that's all part of the law. But then once they make a final regulatory decision, because that action will take place after the April 22nd, 2016, it would be subject to preemption, even though the law itself was passed, I think it was passed in 2006 or so. So that's the difference between the actions and the laws, and why that's important in this bill. So the second piece, though, there are a few laws that are on the books that are wholly preserved that were passed before August 31st of 2003. That includes California's Prop 65, which is a warning law. It requires a label on products that contain chemicals known to the state of California to cause cancer or reproductive harm. There's a law in Massachusetts, the Toxic Use Reduction Act, that would fall into that. And then there's also a law in New York that would enable a ban on hazardous chemicals in children's products. So those are a few examples. They're not many. Another thing that was preserved is the implementation of other environmental laws, so strictly environmental laws that happen to deal with chemicals. So there are some air, water, waste treatment, disposal, reporting laws. So potentially there are some global warming laws, for example, that contain chemicals that may be TSCA-regulated chemicals, and so that would be protected. Some of the mercury disposal laws that are in many states around the country, those would be preserved. The fourth category of actions that are protected are co-enforcement. So if a state has an identical requirement as the action that the EPA has taken under TSCA, that state can continue to co-enforce that identical requirement. The penalty in that case can't exceed the federal maximum, but they are allowed to continue to enforce. And then finally, actions on chemicals identified as low priority by the EPA. So if the EPA designates the chemical as a low priority, the state is free to act on that chemical. So moving on to the next slide, which is 26. There are a number of actions that are undermined, and I spoke a little bit to that, but these actions are preempted. So if the law requires the development of information that's reasonably likely to be identical to info that EPA has required industry to generate, then that is preempted. The idea being that a company, if it's being asked to generate data, it shouldn't have to do that, generate that data over and over again. It could just go to the EPA, and then the state should be able to request the data from the EPA if they need it in their activities in the state. Second is if the EPA finds that a chemical is found not to present an unreasonable risk following the EPA risk evaluation, and it does a restriction, states are no longer able to act on that. And then finally, if the chemical goes through the process, EPA finds that it does present an unreasonable risk, and then takes a final action with a risk management regulation and puts that in place, then states are no longer able to act on that chemical for those uses. There is a little wiggle room for state action, and I think that's important to know. We're now on slide 27. So any preemption is limited to the hazard exposures, risks, and use or conditions of use included in the scope of the EPA risk evaluation. So where there is a concern at the state level on a chemical that wasn't included in the scope, then states are free to ask. Free to act. So, for example, if the EPA looked at, I'll find a good example. So let's say BPA in receipt paper, but it didn't include in the scope BPA in children's pacifiers. And a state was concerned about children's pacifiers, even though EPA made a rule about BPA and receipt papers, the state can continue to act on BPA and pacifiers. And then secondly, states can seek a waiver from preemption. So if the state can show that there are compelling conditions in that state, it can apply for a waiver to continue to act or protect its residents from that chemical for that use. Now, one thing I want to say about the preemption in general is, as Eve noted, TSCA really only covers certain chemicals and uses. So it doesn't cover things like pesticides. It doesn't cover things that the FDA covers, like BPA in food containers or parabens in cosmetics. So none of those things would be preempted with TSCA action. So that's another area. So moving on to slide 28, there is an early preemption, what's also called a regulatory void or a pause preemption. So the state regulation of high priority chemicals is preempted starting when EPA publishes the scope of the risk evaluation until the date that EPA must complete the evaluation. So there's potentially a 3.5-year window from initiation when the states are not able to take action. Unfortunately, at that point, the EPA hasn't taken action either. So that is a bit of a concern, because at that point, nobody is on the regulatory beat in terms of protecting us from a chemical that was identified as a potentially dangerous chemical because it was put on the high priority list. The next thing to note is that the pause preemption doesn't apply to the first 10 work plan chemicals or the industry requested chemicals. So in this first phase, that pause preemption doesn't apply, and then states may also apply for a waiver from that preemption. So what does that mean in terms of what we can continue to do outside of the TSCA process? So chemicals and uses that are not covered by TSCA, disclosure laws are allowed to continue, work on procurement or purchasing, market campaigns, so looking at how chemicals are in the marketplace, tort cases, actions to influence the EPA choices and fill the gap. Actions are allowed to continue until EPA finally takes action. So we can continue to work on chemicals to try to influence the outcomes and the choices that EPA makes. Petitions, as Eve identified, work with the states on applying for those waivers, and then we're open to other creative solutions. I look forward to that. I'm noticing that I'm short on time, so I'm going to try to run through these quickly. As the NGO community, we've put forward a list of 10 chemicals that's listed here. You can take some time to cruise it on your own. In choosing those, we thought about, and this is through Safer Chemicals, Healthy Families, which is a collection of organizations working on TSCA. So we've chosen those that have clear scientific data about the health and environmental dangers so that EPA can really be successful in the first round, setting up the rules moving forward. And then secondly, it was really important that we identify chemicals that aren't already being addressed in other arenas so that there's an efficient use of resources among all the cops on the beat. So I just wanted to leave you with the fact that there is an opportunity now. There's 89 chemicals to choose from because the first 10 chemicals have to come from the work plan list, and that's the link to where you can find what that list of chemicals is. Really, to answer the question of the title of the presentation, will this be successful in protecting public health, all depends upon whether and how we can draw public attention to this issue, and whether and how people who prioritize public health engage in all of the steps along the way. Also, it's a slow process, and EPA will only be working on a small fraction of the chemicals that are concerned to public health. So there continues to be a need for consumers to be aware of what's in their products, for NGOs to keep educating the public and testing products, for state legislators to address chemicals in the ways that they can, and for the AGs to keep enforcing the laws in their jurisdiction. And with that, here's my contact information. Feel free to give me a shout if you'd like to talk more about this, and I'd like to open it up for questions and answers.
Wonderful, Ansje. Thank you so much. Thanks to all three of you for your highly informative presentation, which I anticipate has spurred some questions among our participants. So I'd like to move right into that part of our call, and we'd like to invite your questions and comments. As a reminder, this is an open informational forum that includes media participants and is not really a forum for the Environmental Health Coalition to discuss strategies. If you would like to ask a question, please press *2 to unmute your line, and please also state your name and affiliation. Thank you so much. And if your question is directed to one of the speakers in particular, please let us know that when you ask. So again, it's *2 to unmute your line.
Hi, this is Heidi.
Nancy Holt.
Let's go Heidi, and then Nancy, you can be next, okay?
Okay, thanks.
Okay, my question related to Eve's presentation, where it said that a manufacturer can ask EPA to evaluate a chemical, and then they would pay 50% of the cost if it was a chemical that's named in the work plan, and 100% for other chemicals. And I have two parts to my question. One is, what is this work plan that everybody keeps referring to, and is it a good document? Are we relying on a good document or a bad document for the foundation of everything that happens in this new TSCA? And what's the difference? What's the justification for them only paying 50% if it's in the work plan versus other chemicals? I mean, if it's in the work plan, doesn't that mean it's more likely to be bad? You know, that there's some evidence, and so you'd think that those would be the ones that you'd want to make them pay for. I don't know. That's why I'm asking.
Sure. No, that's a great question. And I have to say, as I started saying the word work plan in my presentation earlier, I was thinking, oh dear, I don't think I've explained this. So great question. So back in 2012, EPA, kind of early on in the Obama administration, actually it was really before 2012, they started looking at how they could implement the old TSCA and make it more effective. And they decided that they were going to start really trying to regulate chemicals. And they did a whole analysis of chemicals in commerce, and they put together a list of about 90 chemicals that they considered sort of the most problematic chemicals that also had, you know, a fairly robust set of data characterizing the risks. And that's those chemicals, that it's like 80 or 90 chemicals, that's the TSCA work plan. And if you just Google TSCA work plan, the most recent version is from October 2014, and you can see the list of those chemicals. And you're right, those are the chemicals that EPA at least thought were sort of the prime chemicals that should be regulated. And I think the rationale for why it costs less to manufacturers to nominate those is because EPA thinks if it's going to be evaluating those chemicals, it's a good chance that, you know, it's at that point the manufacturer's interest and EPA's interest is somewhat aligned because that's on EPA's agenda to do anyway. Whereas the other chemicals that the manufacturers might recommend for evaluation, those might not actually, EPA might not really care whether those get evaluated. Those might not be significant chemicals in terms of public health. So if manufacturers want those evaluated, they should pay the full freight, I think is the thinking. I hope that's clear.
Thank you, Patty, for your question. And let's move on to Nancy.
Hi there. I'm from North Carolina, and our state is a mess right now. We have coal ash impoundments across the state, and chromium-6 is in well water. And I just found out that the EPA since 1996 had tested for 81 unregulated chemicals in waters. And they started regulation on 1, and so far they've implemented regulation on 0. Now, what's going to be different this time? And since chromium-6 has been added to chromium-3, and all of the regulations are for total chromium, which is the natural chromium-3, and chromium-6, which is usually from industrial and coal burning. What can we expect reasonably from the EPA in determining? Apparently they had a report ready on the chromium and chromium compounds. However, with industry pushback, they shelved it. Will they bring it out again? Anybody got any answers?
This is Eve. I'm not sure I have a complete answer, but I think, you know, as if you go to the slide 3 of my presentation, or page 3, you know, what are the things that EPA does under TSCA? It looks at manufacture, processing, distribution, use, and disposal. And once a chemical, like, you know, first of all, I should really just say, I'm so sorry. That sounds so awful. But once, you know, hex chrome is in water, TSCA is probably not the primary statute that's going to be used to protect people.
Well, it's listed
TSCA
on the
is more
list
about,
as number 20.
Yeah, it is a TSCA chemical, and so EPA could find it presents an unreasonable risk, and they could ban the ongoing manufacture of chromium. They could say nobody should ever make hexchrome again in this country, or it could significantly limit how it's used in this country. But TSCA isn't a statute for cleaning it up out of drinking water once it's there.
So, no help. Thank you.
I think I think this would be a statute to prevent future, contamination in the future of water supplies from hexchrome, but it's not through this statute that you would get cleanup of existing.
Well, this is ongoing, so it's not going to stop.
If you'd like, we could talk. You could give me a call or send me an email afterwards. We could talk more about it.
Okay, I'll do that.
That sounds great. I would like to get to one or two more questions if possible. We might go over just a few minutes. Does that work for our speakers? Just to go over about 5 minutes?
Yes, that's fine with me.
Okay.
Sure.
So just a reminder, if you'd like to ask a question, to press *2 to unmute your line, and we ask that you try to be brief since we are running out of time, and don't forget to state your name and affiliation. Thank you. And we may not have more questions.
Question, Dr. Joyce Young, naturopathic physician on Cape Cod, Massachusetts. I'm really interested in terms of how the new TSCA compares with the European Union's REACH agreement.
Anybody want to take a shot at that?
Well, I think I can take a shot, and then others can chime in. This is Ansje. There are some overlaps, and but it's a fundamentally different structure. So REACH is really more of a hazard-based approach, where chemicals are authorized based on their hazard traits, and EPA, and under TSCA, it's much more of a risk-based approach. So exposure is fundamental to the risk evaluation. I imagine it's also a much slower process. REACH is going through hundreds of chemicals in the time that we're going through 10. And I think also there is some sort of overlap in that they will be able to share some data, although there will be some confidential business information protection. Anybody else want to jump in?
Thank you. I would like to give all of our speakers an opportunity to make any closing remarks, because it doesn't seem that we have any other burning questions. So if there was anything that you left out of your presentation that you'd like to bring up now, now's the time.
I actually have one more burning question, which I just forgot. There's an issue regarding, oh shoot, what's the word? I can't remember. Oh well, I'm going to shut up because I totally lost my mind. Sorry.
Remember, everyone, if there is a question that comes, send it to me, and I can do my best to direct it to the appropriate speaker to get your question answered. So with that, did any of our other speakers want to make any closing remarks, or should I just move on to my announcements?
Yeah, so this is Mark. So I think that, that we do need to let our states know that the state still has a major role in TSCA. The states don't have to go through the same kind of risk assessment that EPA has to go through. and there are going to be very few chemicals and a limited number of uses that EPA is going to be looking at. And so the states, I think, can continue to be major sources of regulation for chemicals. And secondly, it's important that we weigh in with EPA and getting our states to weigh in with EPA on prioritizing which chemicals should be addressed by EPA sooner rather than later.
And this is Eve. I want to just echo what Mark said about the importance of public involvement in all of this. And as like the example from North Carolina, I think it's really important. I need to understand more about what's happening there and the source of the hexchrome in the water, but I think it's really important that communities be conveying information to EPA about chemical exposures from manufacturing sites, from processing sites, from places where chemicals are disposed of, because those are the kinds of things that frankly EPA hasn't been great at looking to, and there's not great sources. There's not a big compendium of this information. So if we know about places where there are significant chemical exposures during those aspects of a chemical's life cycle, it's really incumbent upon us to let EPA know and really, press it to include those exposures in those communities in its risk evaluations.
Thank you, Eve. And Ansje, did you want to add anything?
I think folks have covered it. It's just so important that people continue to pay attention and press EPA to make good decisions, identify what are priorities in the community.
Great. Well, again, I'd like to thank our speakers and all of you for joining us today. I will be sending a follow-up email with a link to the recording probably within the next day. And I just want to make a couple of quick announcements before we go on our way. Our next call will be on Wednesday, October 26th with Carol Kwiatkowski, Executive Director of the Endocrine Disruption Exchange, and she'll be discussing the latest science research on endocrine disrupting chemicals and its relevance for children's environmental health. Dr. Kwiatkowski is one of several speakers who will be in Alaska to participate in the Children's Environmental Health Summit on October 5th and 6th at Alaska Pacific University in Anchorage. And this is just an incredible event, bringing all sorts of speakers from all over Alaska and the nation to come together and discuss the health disparities experienced by Alaska children and how we can develop recommendations and an action plan to improve the health of our children in Alaska. So please visit our website at akaction.org to learn more about the conference or to register. And it does require advanced registration and space is limited. You can also register on the day of the event, but we certainly prefer advanced registration. There's a full agenda also posted on our website with all of the speakers listed. Finally, if you found today's presentation discussion available, please consider making a gift to support these calls, and your gift will help us to keep bringing speakers like the ones we had today, people who are just totally focused on policy, research, community leadership, bringing all these people together to help stimulate action on these important issues. To make a contribution, go to akaction.org and just click on the donate button. If you have any additional questions or comments, please feel free to contact us. Our Anchorage office number is 907-222-7714. You can contact me by email at Diana, that's with one N, at akaction.org. And thanks again to everyone. Have a wonderful day.
Thanks. Bye.